I'm using the needle that I prefer, is I'll measure up. So we should be able to cover all that area without going in a second time. So because I'm using Juvederm 4, I'm going to go in at a 45-degree angle, so I shall support myself to go in. And as soon as I'm going to see the bevels just under the skin, I will level off. And then I just check. So you can see where we are, but you can't see the colour of the needle. You alright there? And then just start to inject. And see the skin coming up. And slowly withdraw. So that top bit takes a bit more. So you can see we're at that point there. I'm just going to soften that once more. And stop injecting just before we come out. You see it's instantly come out, and then we'll just do some massage at the top. So if you have enough for me. So it's just softened, but not taken away for this bit up here, and then we've got the lower bit to do. I'll use this short needle just to show you that you can use it too. So this is a line, so I'm going under the line rather than medial to it. See the skin raising. So we've got a very natural improvement. I haven't even put the full syringe in there, so it's just softened it. So we could do more, but I think in actual fact that's just enough to take the, it looks so natural, is what I'm trying to say.
Yeah, you can see it, can't you? Right.
When you've got the two to compare, you see quite a difference. I suspect if we did the other one, you would go, ooh, there's still a bit of a line. Cause
when you start out and you're showing people after one, you tend to do the one that needs less first. So they've got a really good improvement. So line up and show me where you're going to.
you're there.
Yes, lovely. Lovely.
Oops, okay.
Well done, you're following the contour of the face very nicely. So you can see that you're not going any deeper and you're not going any more superficial. And just feel where the end of the needle is or lifted. You can just take it a little bit more. That's it. And then fill that area.
Right now.
So you're watching the skin to see if you get any blanching or any flashes. You can get a little bit more into that area. See? It's
quite thick, isn't it?
Yeah. Do a little bit more in there. And just lift the needle for me. You just bring it slightly more to the right. That's it. Super. Sometimes we need to fan in that top area. Okay. Just do a little bit up.
Okay. You got a bit numb under there now, does it feel different?
Mm-hmm. Slightly.
Good.
Yeah.
Open your mouth a little. Lovely. Oops, sorry. Move it out there.
Yeah, it's done that very nicely. In fact, we need to put a bit more in on this side now because we've
So my wicked person.
have a try with
Yeah.
the needle it comes with. And the thing is as well with people that if people aren't happy, they often don't come back, do they?
No.
And that's the problem.
Mm-hmm.
Because they're the people that you not only lose but tell other people. So if you book them in for a review, full stop. Okay. So you'll find it, I mean, although there's some product already out of that syringe, which makes it easier, you'll still feel a difference between the two needles. It's a smaller needle, okay?
So we need a little bit more right up here.
Yes, yeah. And that you could do a bit of a fan action.
Across there, taking it more like that.
Yeah.
Okay. Here we are.
Lovely.
Is that now numb in there?
Mm-hmm.
Yeah, you didn't wince.
And that's the other lovely thing about taking it slowly and going from side to side of it.
I think it maybe it feels like it's easier this time with this needle. I think it's because I've got used to the pressure now.
Yeah, it takes much more pressure than you think. It's when you're at the start of the syringe with that one. Even my hand gives a little shake getting it out, which isn't good on camera.
It becomes quite artistic after a while.
Yeah, it is. It's you'll do well if you think of it in that respect.
Can't relax the face again.
So you become slightly more into that line now to fill the gap between.
Hopefully, there we go. So you asked about how many injections. This doesn't seem to matter after it's gone numb, does it? It's,
No.
or maybe. Sorry, maybe. Relax the face again. Good.
Bring it slightly more medial, just sort of there, here. That's it.
You want to smile? Relax now. Like that. Okay, maybe a bit more in there.
Yeah.
Just to bring it out right.
Lovely.
Okay, smile. Big smile. Relax now. Okay.
Okay, nice. That's the movement you do if you had product that had gone up into the cheek.
Alright.
And sometimes if somebody's very expressive, after a couple of weeks you'll feel that it's moved up a little bit and then you can show them. But if it goes up, they can actually bring it back into that fold area. So a little bit in there.
There is, I don't think that you did that little area there. I've not done anything there.
Yeah, this one's still more pronounced though, I think. You can see them. Yeah, I'm doing you two. If you do that one first, and if there's any left, a touch more on that side. It should be really numbed. So there, go in the line while being medial. That's it, exactly as you do it. This one. Yeah. See, that's probably better nice. So just put the mask a little bit in that line on this side.
Can you smell anything? Okay, cool.
Done.
Catherine.
So, yeah, you know, another day we could do this area here. Look at the canvas and we can say that it's not quite finished, we'll do this area and perhaps that on another occasion. That's very nice.
I mean, you've got quite, as you know, you've got quite high cheeks, haven't you? So you will still have a shadow there if you look at it in the wrong light. If you look straight on now, the deep groove has gone.
And this is a calming cream with a base of licorice, which I've been using after filler, which is really nice and takes it out. So my advice as well is to try and up your fluid, because hyaluronic acid is water loving and will absorb the moisture. That's how it sort of lasts longer. So if you just drink a bit more water and keep your face nicely moisturised, then that will, I'll just have a little feel inside.